I enjoy CrossFit because it's an outlet for me. I get away from my children for an hour and my family, and it relieves stress because you lift heavy weights and have a community that support you with healthy activities. I can back squat 250 pounds, and with that, the weight on my shoulders when I squat down, I end up peeing myself as I come back up because the gravity and the weight and all of the pressure makes me pee. My name is Jordan Young, and I am 39 years old, and I have 4 kids, and we currently live in Orlando, Florida, and I'm a special education teacher. I was experiencing symptoms pretty often after I had my second child. It was just little spots of pee or whatever. I didn't know exactly what it was because it was new. Then I had twins in 2020, and then the symptoms were daily, and it consisted of laughing or a big sneeze or coughing, and I go to the gym every day, and that's where it really starts to become an issue because I have pee in my pants and people notice that, so I have to wear certain colors, black where you can't see. So it's over the years it's become more and more consistent. Living with stress incontinence is horrible, and it pretty much sucks, but I make it a joke. I make it fun and funny because it makes me feel better.
So, stress urinary incontinence, SUI, we lose the muscular support, we lose the ligamentous support around the urethra, and suddenly the abdominal pressure gets raised from coughing, sneezing, laughing, exercising. The big question is, I always ask my patients, if you do a jumping jack, are you gonna leak urine? And that's a pretty good test if they're able to, whether or not they're gonna leak.
Incontinence hasn't stopped me from doing anything. I still work out every day. It does make a difference because I have to buy pads regularly, not just once a month. I also have a lot of other issues that come with wearing a pad so much, such as a yeast infection, itchy, the moisture down there from peeing is without the cotton underwear breathing through. Really does also impact you that I've had to go to the OBGYN a lot because of these other vaginal issues.
So Jordan has had several vaginal deliveries. After her twins, her leakage was significantly worse. She went to wearing about 5 or 6 pads a day. She tried Kegels on her own. She was also given a vaginal stim. She used her vaginal stim very regularly for several months and also did not notice a difference. I recommended pelvic floor physical therapy. She did over a year of pelvic floor physical therapy, both with an instructor and on her own. Her leakage she rated as improving by about 15%, 20%. So she may have gone down a pad a day, maybe.
After I tried the Kegel exercises on my own and then the device, I eventually ended up going to a physical therapist who specializes in Kegel exercises. But with my busy life, it was hard for me to get into the office, every other day or every few days for an hour. Basically, it was hard. So I had to eventually stop.
So she really went through the journey of having little leakage to much more extreme leakage. And she also tried her very hardest to treat this non-surgically over time. Really, there are 2 well-known treatments for stress incontinence. The first one is a urethral bulking agent injected directly into the urethra. I explain this to patients in this way. If your urethra is a pipe and you inject a bulking agent, I'm clogging your pipe. So clogged pipes are much less likely to leak as much. Unfortunately, statistically, that treatment really only helps for a couple years maximum. The gold standard is a mid-urethral sling. There's different ways to do a mid-urethral sling, and I think that patients should look to find a surgeon who's well-versed in slings, who's well-trained and well-experienced in different types of slings and how to do them. and match that up for what's best for the patient specifically. Jordan is someone who is a busy mom. She's a teacher. She unfortunately has to hold her bladder at times because she's a teacher. She does CrossFit, which involves lifting large amounts of weight above your head, and had lots of leakage, and every day is really working hard at destroying her pelvic floor with that. So we felt like having a bulking agent was really not going to cut it for her. She's young. She does not want to have a procedure that has to be repeated every 2 to 3 years.
The next option after consulting Dr. Zell was a mesh sling. And so I said, that sounds like a good idea. Let's give that a try since I had already tried everything else.
We felt that now that she's ready with everything she's been through, this would be the best option for her moving forward, as she is not having any more children. I can tell you right now, the easiest for the patients especially is the Altis Sling. There is the least amount of mesh. There is ease of incision. There is ease of patient postoperative care. They do not have to be home in bed for days afterwards. They don't need a catheter. They can go on their own. There's only one tiny little incision, that's it, not multiple incisions. Patients just do so much better with an Altis than they do with a retropubic with several different incisions, a transobturator. It just makes so much more sense for them.
My impression about the sling when Dr. Zell showed me was, one, that it was a small little mesh sling that goes in and holds the urethra and you stop peeing yourself, which is fabulous. And she also mentioned that the recovery time is short. Going into the surgery, I'm a little nervous because after the procedure, I'm worried that it might not work and my leakage might not stop. And I would really, really want this to work. So what I'm really looking forward to about after the procedure's over and I'm healed is going back to CrossFit and not leaking anymore and lifting 250 pounds because I've put myself on restrictions because it's uncomfortable when I leak. I'm hoping that I don't have to buy so many sanitary products except for once a month. And I'm hoping that my working out regime will be more comfortable for me. I'll stop getting infections and rashes due to wearing the pads. I'm hoping that I will be able to pick up my kids without wetting myself and just basically having a higher quality of life after this. I am interested in sharing this journey because after speaking to the doctor, this is something that can get fixed and I don't have to live with it for 20 years. And I want other women to know that stress incontinence is not okay and it can be fixed, and you don't have to live with this. You don't have to have wet underwear all the time or wear pads or make sure that you have an extra set of underwear because you sneeze and you pee when you're out in public. I want women to all enjoy life without having that experience. So I want to reach out to people that are experiencing this, that need to know that this is an okay thing for us to do at this age. Because when I'm 80, I probably won't care as much or be as active back as I am now.
Younger women can be and are fantastic candidates for slings. I would caution that the one consideration you want to make is that young woman going to become pregnant again? I usually recommend against a sling because nobody wants to have their surgery repeated. Young women are dynamic, their lives are changing, they're busy. A lot of them are already spending time at the gym, working out. They may have already gone through a lot of the pelvic floor training. They may have already gone through Kegel exercises, and a lot of them are still having leakage. Sometimes it's just not enough. And I certainly don't think we should let them suffer. This is a quick, easy solution for you. You get back to work, you get back to school, you get back to your kids, you get back to working out at the gym, and your quality of life is significantly improved.
I have a friend at the gym who is also experiencing the stress incontinence. She has a couple kids as well, and she's eager to hear about my experience and my recovery because she's interested in getting this procedure done as well.